Welcome back. The Western Cape is now the epicentre of the country's COVID-19 pandemic. That's according to the latest national figures. It's officially overtaken Gauteng as the province with the most infections and deaths. Aisha Ismail spoke to some key leaders in that province to find out what might be contributing to this change. So Aisha, first take us through the figures in the Western Cape.
Well, Shahan, the figure as it stands now for the number of infections in the Western Cape, it's 1,314 with 28 confirmed deaths. And as you say, I did speak to the Premier of the Western Cape, Alan Winde, earlier. And while he said that he was, of course, the authorities are concerned about the increase, he said that this was expected given the rigorous screening and testing regime that the Western Cape had embarked on. And he said that they were expecting this figure to increase and actually said that this figure is going to increase even more, and mentioned a figure of, by the time we reach the peak week, as he put it, in August, the number could very likely reach 80,000 infected cases and people with symptoms. So, as I said, this number is going to increase at an alarming rate. And he also pointed out that despite the fact that people have been asked to obey the lockdown rules, to obey social distancing, people are not doing that, and did also say that the premiers now have added powers, and this means that it is actually up to the premiers now, in conjunction with the health MECs and after consulting the National Minister of Health, to make decisions whether they, come down to a level 4 or whether they can come down to a level 4. And if they do not bring the infections under control, they could then elevate this to level 5. So the premiers do also have those powers now.
So Aisha, take us through some of the most infected areas that are being picked up right now.
So, Shahan, you will recall that initially the infections were confined almost to a specific group, and these were the people who were travelling abroad either for leisure, for pleasure, or for business, and coming back to South Africa. And then, of course, we had tourists coming into South Africa. So that is where the infection started. But according to the Premier, we're now seeing the infection spreading to a more general group. He also talked about factories and places where food is being processed and sold, and retail areas, and he is very concerned about that as well. He also mentioned 3 particular hotspots in the Western Cape, in the city, and those are Mitchell's Plain, Khayelitsha and Noon. And just once again, he did make a call to people in the Western Cape, in the city of Cape Town, saying that they have to abide by the rules and regulations pertaining to the lockdown. Social distancing is very important because we need to get the infections under control. Otherwise, he will have no option but to amend the levels of the lockdown. So let's assume, for instance, we do come down on the 1st of May to level 4. If we do not bring the infections under control, he has the power to take it back to level 5.
Yeah, so let's talk about any special measures now being put in place, given that the Western Cape is the new epicentre of this virus.
Well, basically what the Premier did say was that they were expecting the infection rate to increase because they have embarked on this rigorous screening and testing regime, and that is what he is attributing this increase to.